Hi, I'm Dr. Sathya. Every November 14th is a World Diabetes Day is commemorated, which is an opportunity to raise an awareness about the impact of diabetes on the health of people. It is also seek to highlight the opportunities to strengthen the prevention, diagnosis and treatment of diabetes. This year, the theme is Education to Protect Tomorrow. Under Ayur, I am starting a new series of Ayurvedic awareness to enlighten the knowledge through prevention of diabetes, especially to the new generation. We will try to understand, very simplify, what is diabetes. I can tell you it is one illness with many phases. At one time in recent history, many of the today's chronic diseases were understood to be the symptoms of diabetic. The strokes, both ischemic and hemorrhagic, heart failure due to the neuropathy, as well as both ischemic and hemorrhagic coronary events, obesity, atherosclerosis, elevated blood pressure, elevated cholesterol, and elevated triglycerides are all known to be a common consequences of a disturbed metabolism as it occurs in diabetes. These symptoms, as well as impotence, retinopathy, renal failure, liver failure, polycystic ovary syndrome, elevated blood sugar, systemic candida, and poor wound healing, peripheral neuropathy, etc., have since been turned into a separate diseases requiring specialized treatments and specialists to administer them. Although this may have greatly served the medical and pharmaceutical industry, it has led to untold suffering of patients and cost many lives unnecessarily. Diabetes affects a lot of people. I think it's more than 8% of American population. Many of them have believed that diabetes is inherited and the body is a victim of a genetic flaw or predisposition of the disease. Although genetic reasons can play a certain role in the manifestation of disease, in most cases they are not. They certainly don't explain why the pancreatic cells suddenly decide to self-destruct in type 1 diabetes, or why common cells in people of the age of 50 or older for no apparent reason decide to block out insulin laden the sugar in type 2 diabetes. Many patients and the doctors assume that diseases manifest because the body somehow makes a mistake and thus fail to do the job properly. This idea defies all sense of logic and scientifically it is incorrect. In this world, every effect has an underlying cause. Just because doctors are not aware of what causes pancreatic cells to stop producing the insulin doesn't automatically imply this an autoimmune disease, a disorder in which body presumably tries to attack and destroy itself. By developing diabetes, the body is neither doing something wrong nor it is out to kill itself. It certainly finds no pleasure in making you suffer and feel miserable. What we really should be focusing on to create the circumstances that the body would require to shut down the insulin producing capability in the type 1 diabetes and increase in the type 2 diabetes. With a huge number of sophisticated survival mechanisms, the body makes every effort to protect you against further harm than has already been caused through the inadequate nourishment, emotional pain, or a detrimental lifestyle. When seen in this light, disease becomes an integral part of the body's effort to prevent a person from committing unintentional suicide. It can firmly state that your body is always be on the side, never against you, even if it is appears to attack itself as it is so called an autoimmune disorder, such as in type 1, in lupus, in arthritis, cancer and rheumatoid arthritis. Just as there is a mechanism to become diabetic, there is also a mechanism to reverse it. To call diabetic regardless whether it is a type 1 or type 2, an irreversible disease reflects a profound lack in understanding the true nature of the human body. Once the preconditions of restoring balance or homeostasis have been created, the body will be able to use its full repair and healing abilities. Almost all of us know how to heal a wound or mend a broken bone. Many of us lose this ability when the immune system becomes impaired, when prescription drugs interfere the blood clotting mechanism, when the body becomes severely congested with toxic waste matter. In the case of type 1 diabetic, pancreatic cells don't stop producing insulin because they are tired of doing their job. In case of type 2 diabetes, the body's 60 trillion cells don't just resist the insulin that comes into contact with their cell membrane because they are developed an aversion to it. In both the situation, the cells are prevented by doing their job for a number of reasons, all of which are basically under our control. If we stop destroying the cells directly or indirectly by the way we eat and live, they can just as easily be programmed, nurtured back to life, or to be replaced by the new cells. Healing the pancreas is not so much different than healing a broken bone. However, for healing to occur, we must make certain changes that facilitate the healing, not counteract it. Treating diabetic on the symptoms level prevent its cure. On the other hand, it is not difficult to determine what causes insulin secreting pancreatic cells to malfunction in type 1 diabetes and then to remove the cause. To perform properly, these specialized cells require adequate nourishment. Insulin is a vitally important hormone that all of us need to transport essential nutrients like protein, sugar, fat, especially glucose into the cell of the body. If there is not enough insulin available to deliver these nutrients to the cells, sugar, for example, becomes trapped in the blood, causing it to rise to dangerously high levels. In the case of insulin-dependent diabetes, which occur in both types, it would seem to make sense to inject insulin into the blood in order to remove the excess sugar, the fat and the protein molecules from the bloodstream. However, without investigating and rectifying what has actually put the body into the awkward position, merely administering insulin shots to the patient to enforce lower blood sugar does not solve the problems, but as we will see, makes it worse. This quick fix approach actually makes a true cure impossible and at the same time increase the risk of developing many other ailments. If you know to be a fact again that the diabetics suffering from either type has an increased risk for heart disease, cancer, stroke, blindness, Alzheimer's disease, etc. The question rises whether this risk is really due to the diabetic itself or its treatment. I propose that diabetes has become such a dangerous ailment because it is treated on the symptom level rather than on the causal level. In a non-insulin dependent type 2 diabetic receives an insulin shot, it can seriously harm or kill him. As surprising as it may be, a healthy person who receives insulin shots will develop diabetes, which is not so uncommon. Given the high percentage of false positive blood tests nowadays, once a diabetic is always diabetic. It is a sad consequence of medical intervention. However, it does not need to be this way. For example, scientists at a Toronto hospital recently made a stunning discovery which would lead to a near cure of type 1 diabetes. The researchers injected diabetic mice with capsaicin, the active ingredient in the red pepper, which counteracted the effect of malfunctioning the pain neurons in the pancreas. The mice become healthy practically overnight. Conventional wisdom stipulates that type 1 diabetics is caused solely by his body's immune system attacking the pancreas. The new research, however, shows that this is not true. Apparently, the nerves also secrete neuropeptides that are crucial to the proper function of the pancreas. Restoring proper nerve function through simple methods such as the above may be all it takes to end the type 1 diabetes. Capsaicin is already proven its healing property in the treatment of joint pain and inflammatory condition. This shows that a cure doesn't have to be complicated and expensive. With regard to the type 2 diabetes, there is an ample evidence that is 100% curable with natural methods. We will be coming with new videos regarding the food that which is causes diabetes and the complications in diabetics, how we can prevent it. Please go through the channel and subscribe the channel that you will get the messages when the video is being posted. Thank you.